Did you know that you may feel and move like you're 20 years younger with only 5 easy exercises? As we age, many of us come to terms with becoming weaker and more fragile. Here's the exciting news though. In just a few weeks, a unique training regimen can physically reverse aging. I'll demonstrate that strategy in this video, along with the top 5 scientifically supported workouts you should perform to maintain your strength and health, particularly if you're over 50. Before we begin the exercises, let's discuss a crucial yet frequently disregarded component that affects our longevity and mobility. The Greek words sarx, which means flush, and penia, which means loss, were combined to create the term sarcopenia in 1989 to refer to age-related muscle loss that begins in our 3rd decade of life. They were unaware at the time of how quickly this illness worsens after the age of 50. In 2019, sarcopenia was formally acknowledged as a medical disorder. Why? Because studies now indicate that it is a leading cause of falls, frailty, and impairment in the elderly. Here's the good news though. Recent research shows that sarcopenia is not only avoidable, but potentially reversible, including a groundbreaking study conducted in 2024. According to this specific study, with the correct exercises, older folks can recover muscle loss in as little as 12 weeks. You may be asking yourself, I already know that exercise is important. Here's the catch though. Not all exercises are made equal according to the study. You risk injury or wasting time if you perform the improper exercises or use the incorrect technique. For this reason, in this video, no matter your age, I'll show you the top 5 anti-aging workouts and the method that scientists have dubbed the gold standard for reversing muscle loss. The main muscle groups in your body will be the focus of these 5 exercises, which come in both easy and difficult versions to accommodate all fitness levels. Now let's move on to the first exercise. I advise practically all of the over 50 patients in my practice to do this. The squat is it. The largest muscles in our legs, the glutes, quadriceps, and hamstrings, are worked during squats. These muscles are essential for walking, climbing stairs, and getting out of a chair. However, most individuals are unaware that squats also work our core and back muscles. Our trunk becomes more stable and resilient as a result, which eventually assists with daily activities like lifting, bending, and carrying. Here's how to perform squats properly. Place your feet shoulder width apart and begin standing. You can either cross your arms in front of your chest or hold them straight in front of you. Lower yourself gradually as you inhale by bending at the hips and knees. Don't forget to stop at the bottom. Breathing should be deep and the back should be straight. Focus on working your big leg muscles such as your quadriceps and glutes when you stand back up after exhaling. For this workout, I usually suggest doing it in 2 sets of 10 repetitions. Using a weight in your hand, such as a dumbbell weighing 10 or 15 pounds, might make it more difficult. Slow sit stands can be made easier by using a chair, where you can use the armrests for balance. Once more, begin with 2 sets of 10 repetitions. As you build strength, you can increase the number of repetitions. Before you start doing squats every day, there is one important thing you should know. Without it, you run the danger of getting hurt in addition to being frustrated. I'd like to introduce you to Adrian, a 60-year-old patient of mine who, in a matter of weeks, went from having trouble walking to his mailbox to being able to stroll and garden for an hour. Adrian used to like playing with his grandchildren and gardening, but he was unable to do either after hurting his back. He could only walk for 10 minutes when he came to visit me. I supplied several exercises to Adrian. The squat was one of them, and I also put him on a basic regimen that involved walking for only 5 minutes each day. I wish all of my patients knew this trick. This is known as the golden rule of rehab, and I encouraged Adrian to increase his walking and exercise time by 20% per week. Intensity is never as good as consistency. After 2 months, Adrian was able to resume gardening for an hour, triple his walking time, and regain the strength to play and lift his granddaughter. The main lesson here is that steady improvement is more important than quick progress. We must concentrate on consistency and small changes if you want to increase your strength and stop muscle loss. Consider a marathon rather than a sprint. Scientists now consider progressive strength training to be the gold standard for halting muscle loss and reversing the effects of aging. Now that you are aware of this principle and methodology, let's move on to the second exercise. Another workout I suggested to Adrian is this one, which focuses on strengthening your back and core. The second exercise is known as the modified crunch. Your core muscles, especially the rectus abdominis, popularly known as the six-pack muscle, are a great target for crunches. More significantly, though, the modified crunch strengthens the deeper muscles of the back and trunk, which helps develop a strong core. This is vital for maintaining proper posture and trunk stability, as well as for preventing back discomfort in later life. This is the modified crunch, which is a version that most people can execute. With your feet flat on the floor or your bed and your knees bent, lie on your back. Your hands should be on your thighs. From here, pull your belly button down toward the floor to activate your abdominal muscles. Imagine your low back flattening on the bed and your core muscles becoming a little firmer. An easy way to relieve back discomfort is to tilt your pelvis slightly. From here, take a deep breath and raise your shoulder blades off the floor as you release it. Instead of tugging with your neck or chest, concentrate on curling up with your abdominal muscles. For 2 sets of 15 repetitions, only raise yourself as high as you can. Hold it for a second at the peak, and then slowly lower yourself back down as you inhale. You can put your hands softly behind your head for a little support if you experience neck ache. Again, though, avoid pulling with your neck. Keep in mind that quality is more significant than quantity, and make sure the majority of the movement originates from your core. Throughout the exercise, focus on keeping your breath steady while using your core. You can use a weight on your chest, raise your lift, or just perform more reps to make this more difficult. For a simpler variation, you can do a partial crunch, which involves raising only your head and shoulders an inch or two off the floor. Your core should still be able to feel this. As with any exercise, pay attention to your body and increase your pace gradually as your strength and endurance increase. After working on strengthening your core, let's move on to an exercise that will simultaneously test your flexibility, strength, and balance in your lower body. The third exercise is known as the reverse lunge. Squats and lunges are important exercises for strengthening the legs and glutes, but they're not the only ones. As I indicated, many of my patients over 50 suffer from back discomfort, which lunges assist to alleviate by using your stomach and back muscles. Regular lunges have been shown to improve bone density and lower the risk of osteoporosis in addition to improving the health of your knee and hip joints. I'll now demonstrate a lunge variation that is considerably simpler than the common forward or walking lunge you may encounter. To begin, stand with your feet shoulder-width apart and grasp a chair or counter in front of you for support. Take a wider than usual step backwards while maintaining a straight back, while your rear leg stays on the toe and bends as far as possible at a right angle. Your front leg should form a right angle at the bend. To lower yourself smoothly, bend both your hips and knees and visualize a straight line from your back to your neck sliding downward as a single unit. Just aim for a distance of roughly 3 to 5 centimeters from the ground. Your knee doesn't have to contact the ground, keeping your abdominal muscles active and remembering to breathe during the exercise. Slowly and smoothly rise from the bottom. Aim for 1 set of 10 repetitions on each side, then go back to the beginning position and repeat on the opposite side. I would advise beginning with tiny lunges, lowering yourself only 25% of the way down if you have arthritis in your knees or hips. If you have greater strength and mobility, you can attempt a more difficult variation in which you remove the support and hold a 10-pound dumbbell in each hand for extra challenge. Once more, try to complete 1 set of 10 lunges on each side. As your strength increases, progressively increase the amount of lunges and their depth. It's time to work on the important muscles in our upper body, now that we have developed our legs and core. The fourth exercise is a modified push-up. Nowadays, push-ups are an effective way to strengthen your upper body, targeting your triceps, shoulders, and chest. They also work your core, which helps you lift, carry, push, and pull more effectively. Adrian was able to develop the strength necessary to raise and play with his granddaughter thanks to this crucial workout. Here's how to do a push-up, starting with a beginner-friendly modified version. Maintain a straight body from your head to your knees by placing your hands on the floor, slightly wider than shoulder width apart, and keeping your knees on the floor. Now, while maintaining a straight body, bend your elbows to descend yourself towards the floor. Try to descend until your chest is only little higher than the ground. Once more, you don't have to touch it. Using a steady fluid action, slowly raise yourself back to the starting position. Throughout the exercise, maintain a straight body by using your core. Try to complete 2 sets of 10 reps. Now try this simpler variation against the wall if you have shoulder issues or limited upper body movement. Place your feet about a foot away from a wall and face it. Your hands should be just a little bit wider than shoulder width on the wall. Push yourself back to the beginning position after bending your elbows and leaning towards the wall to bring your chest closer without touching it. This is a low-impact method of strengthening your upper body without overtaxing your shoulders. Using a countertop or putting your feet farther from the wall will always make this more difficult. Now you can always push yourself with the full push-up if you have more strength and agility. The sole distinction is that you're standing on your feet instead of your knees. However, maintain a firm core and a straight body from head to heels. Whichever form you decide on, start with 2 sets of 10 reps and work your way up as your upper body strength increases. There is one more exercise that is essential to preserving your independence and mobility as you age. The last workout is about to begin. The glute bridge is the 5th and last exercise. Furthermore, it is, in my opinion, the most reliable predictor of general strength and mobility far into your 70s, 80s, and beyond. You have the strength required for basic daily tasks, including getting out of bed, sitting, walking, and climbing stairs if you can complete 10 to 20 repetitions of this exercise. Additionally, I advise the majority of my patients to include it in their daily routine due to its functional significance. Here's how to do the glute bridge then. Place your feet level on the floor or bed, knees hip-width apart, and lie on your back with your knees bent. For stability, keep your arms by your sides, palms down. From here, lower your belly button to activate and tighten your core. Squeeze your glutes as you raise your hips off the floor and push through your heels as you take a breath. Just move as far as you can. Your body doesn't have to create a straight line. Maintain this posture for a short while, making sure your core and glutes are working. Breathe out as you return your hips to the floor, gradually keeping your balance the entire time. Doing 10 repeats in 2 sets. Try adding a one-leg variation to the glute bridge to make it more difficult. When performing the bridge, lifting one leg increases the intensity and works your side glute stabilizer muscles even more. Start by concentrating on holding and tightening your glute muscles while maintaining your hips close to the floor for a simpler variation. As you gain strength, you can progressively raise your hips only 1 to 2 inches off the ground. You'll discover that you can lift more weight and complete the exercises more easily as time goes on. Now, 2 important pointers for people over 50. Throughout the exercise, make sure your core muscles are used and avoid arching backwards or extending your lower back excessively. Just be careful to do this in a calm and fluid manner. Here's something even more thrilling now that you know how to increase your muscle mass and strength. Did you know that you can walk like you're 20 years younger with just one easy trick? I'll teach you the one exercise that will enhance your walking right now if you click on this video. Anyone over 50 will love it. See you there.